Most people think that colon cancer only affects older adults. However, we are seeing a rising number of colon cancer being diagnosed in younger patients. Many of those younger patients have symptoms that they didn't realize were warning signs. What's going on, guys? My name is Brianna. I am your gastroenterology nurse practitioner, and March is Colorectal Cancer Awareness Month. Today, I want to share with you guys symptoms you should never ignore, when you should get screened, and why early detection literally saves lives. Now, disclaimer, before we get started, I am not your nurse practitioner. I am not your primary care provider. And this video is literally for educational purposes. If you need to figure out when you need to get screened or are having symptoms that you would like to address, please talk to your primary care doctor or a GI specialist so that you can get personalized medical care. So what is colorectal cancer? Colorectal cancer is cancer that develops in the colon or the rectum, which are a part of your large intestine. Some colon cancer typically starts as colon polyps. Colon polyps are small tissue growths that grow on the lining of the colon. They can be benign, sometimes they can be precancerous. Precancerous colon polyps over time can turn into full-blown cancer. Screening things like colonoscopy, doctors are able to go in with what we call a colonoscope that has a camera on the end of it. We can visualize the full colon and also the small intestine. This allows us to detect colon polyps. We can remove those and send those to pathology for testing to see if they are benign or precancerous and have you to follow up appropriately. That is why early detection with colonoscopy is so important. March is recognized as Colorectal Cancer Awareness Month, and the goal is to raise awareness around screening, early detection, and prevention. Colorectal cancer is the second leading cause of cancer-related deaths in the U.S. Let me say that again. Colorectal cancer is the second leading cause of cancer-related deaths in the U.S. However, if detected early, it is one of the most treatable cancers that is out there. So you're probably wondering, well, when should I get screened? I'm so glad you asked. So colorectal cancer screening typically starts at age 45. Now, I know that screening guidelines used to highlight age 50. However, the statistics for the numbers of younger patients being diagnosed with colon cancer are very high, which is why they knocked the screening age from 50 to 45. During your annual visit, you and your doctor should be talking about age-related screenings and what you need, and colon cancer screening will definitely come up in the conversation as one of them. There are some instances where patients can also get screened earlier. Those instances include family history of colon cancer, most notably in first-degree relatives, which are mom, dad, and siblings. If you have a family history of colon polyps, precancerous, or benign, you can talk with your GI specialist about what they recommend as far as screening early is concerned. If you have a chronic condition like ulcerative colitis or Crohn's disease, those patients would definitely be screened earlier just because they are more predisposed to developing colon cancer. There are also some genetic conditions that might require for you to get screened earlier for colon cancer. In that case, I would speak with a genetic specialist if you have access to being able to be referred to one, or for me specifically, our GI department has a gastroenterologist who specializes in GI and genetics. And so when I have patients who have certain genetic conditions or may have a history of a genetic condition, I refer my patients to her so that they can speak with her regarding what the screening process should be and when that should start. Overall, again, I recommend just talking to your primary care provider and seeing if a gastroenterology referral is warranted so that you can talk with them about specific recommendations that are specific to you and what your personal risk factors are. So let's talk about screening options. I know every time somebody hears colonoscopy, they're like, I don't want to get that. We have multiple screening options, the one being colonoscopy, the second being a Cologuard. So first of all, we usually just say that the colonoscopy is a gold standard. Why I love the colonoscopy so much is because we can absolutely visualize the entire colon and the small intestine. And if there's anything that is detected that we need to biopsy or remove, we can do so at that time. So I think that is why everybody is like, do the colonoscopy. I would have to agree. Even if you don't have any family history of colon cancer or maybe not having any symptoms, you can just go ahead and get an all-encompassing exam and see what's in there. That's how I feel about that. What does a colonoscopy consist of? Colonoscopy is done under sedation, so moderate sedation where you'll go to sleep. They will take a colonoscope that has a camera on the end of it, go in, look at your full colon and small intestine to detect any abnormalities. Top 3, inflammation, bleeding, colon polyps. Colon polyps are standardly removed from the colon. If they are found, sent to pathology again so that we can see if they are precancerous or benign. This also gives, again, full coverage to what is going on, and then based on findings is what would be recommended for follow-up, basically. So for example, if you're a patient who has no family history of colon cancer, this is your first colon cancer screening, they don't find anything, recommendation for follow-up is 10 years. However, again, I am not diagnosing anybody. I am not your GI specialist or your primary care doctor. So when you do have a colonoscopy, you will be able to, one, get recommendations on when they would have you follow up based on what they've seen during your colonoscopy. The second option for screening are our stool-based home kits or tests. So that includes a Cologuard and also FIT tests. Cologuards or FIT tests, either, I think a FIT test you have to do at the lab, but the Cologuard can be sent to your home. So you just do a stool sample, put it in the kit, follow the directions, and send it back. They test it. What does a Cologuard test for? So Cologuard tests for any abnormal DNA in the stool sample that you send, and then also any blood at the time of the sample. If a Cologuard or FIT test is positive, we do recommend for you to do a colonoscopy for further assessment. If it is negative, you follow up in 3 years. That is a gastroenterology recommendation. I know some primary care doctors have their patients to do it every year. Whatever your provider recommends, that is what you do. One thing I really want people to understand is that colorectal cancer doesn't always show symptoms in the beginning. And so that is why screening is so very important. However, if you are showing symptoms, some warning signs that you should be observant of is black tarry stool, blood in the stools, I guess opposite of if you have history of hemorrhoids, etc. But I still think that it's worth talking to your primary care doctor or gastroenterologist just to make sure that it is the external part of bleeding and not something that came from the colon. Also, if you have abdominal pain that will just not go away, unintentional weight loss. This is loss that we're not intending to lose. And if it is rapid, absolutely go and talk to your primary care doctor or your gastroenterologist about the unintentional weight loss, when that started, and how long it's been going on. Some other warning signs that I want you to be aware of are persistent changes in bowel habits. So that is changes in your bowel habits that are not of your norm, persistent diarrhea, and also fatigue. At any rate, even if you think some of these symptoms are like, this is minimum, I don't know, I'm just going to go on about my life, just mention it to your primary care doctor. Just because having a conversation and being educated about it can go a long way. And a conversation ain't never hurt nobody. So I always usually tell my patients, bring it up. If it's something that you think is worth bringing up or it's important about your health, bring it up. If there's just a conversation to be had, we'll have the conversation. If there are options or things that I would like for you to do just to be on the safe side, again, we can do that because you brought it up in conversation. So a little conversation, it never hurt nobody. Bring them symptoms up. Don't put it on the back burner. We want to make sure that you are in tip-top shape. Again, I know I mentioned earlier about the high climbing number of patients who are younger than 50 being diagnosed with colon cancer screening, or colon cancer, sorry. This is exactly why the screening age was pushed back from 50 to 45. Even if you are younger than age 45, please just be cognizant of your symptoms. And if something feels off, just advocate for yourself and your health because you know your body better than anyone else. So when should you consider seeing a gastroenterologist or a GI specialist? If you are having symptoms like persistent digestive symptoms, if you are experiencing blood in your stool, if you have a positive Cologuard or FIT testing, please see a gastroenterologist or a GI specialist. If you have a strong family history of colorectal cancer, or maybe one of your family members just had a colonoscopy and they had colon polyps removed, I again recommend talking to your primary care doctor or a GI specialist about if early colon cancer screening is right for you. Also, if you have any symptoms that your primary care doctor is like, let me just send you a referral to gastroenterology so that you can talk about your symptoms. A gastroenterologist or a nurse practitioner, physician assistant that works in GI can then assess you and your symptoms and figure out if a colonoscopy or any other testing is warranted based on the symptoms that you are having. So let's talk about lifestyle factors and helping to reduce the risk of developing colon cancer. So there are some lifestyle factors that we typically educate patients on about things that they can do to promote colon health. One of those things, of course, exercise and staying active. Smoking cessation, so stopping smoking, quitting smoking, or not smoking at all. And then limiting alcohol intake or the intake of processed meats and foods. Eating a diet that is rich in fiber, it's always the way to go. I don't care how old you are. I always say to just get a lot of fiber in your diet, whether that's through green vegetables, fruits, or a fiber supplement. Do it all, honey. Probiotics also, y'all already know me. If y'all have seen me on Instagram or followed my content, I am a firm believer in gut health, and probiotics is one of those things. Maintaining a healthy weight also. I know we are in an era where we are losing weight and just trying to stay on top of things. And so just managing your comorbidities, whether that's diabetes, hypertension, things like that, by staying active and maintaining a healthy weight is a great thing. So while these factors don't eliminate risk entirely, they can play a role in supporting overall colon health and just putting you at a better trajectory life expectancy wise. Who wouldn't want to do that anyway? So there is one big key takeaway that I want you to take away from this video if you have watched it in its entirety, and that is that screening saves lives. Early detection saves lives. Colon cancer, keep saying colon cancer screening, my bad, y'all. Colon cancer is one of the few cancers that we can early detect precancerous changes and do something about it. That is why screening is so freaking important. So colon cancer screening starts at age 45. So if you are 45 or older than 45 and you haven't had any colon cancer screening, whether that is a colonoscopy or Cologuard, please talk with your primary care provider, have them send you to a GI specialist or gastroenterologist so that you can talk about your options and what screening option would be best for you. Thank you guys so much for watching this video. This is a little bit different, well, not really a little bit different from the content that I typically post because I post a lot of educational content. However, this is a more serious topic. I'm wearing blue today in honor of Colorectal Cancer Awareness Month. And if you have a family member or if you are 45 or whatever the case may be, please just educate yourself about screening options for colon cancer, what you can do, and be observant of symptoms if you're having them. Again, I want to stress that I am not diagnosing anybody through YouTube. I am not your primary care provider. I'm not your gastroenterologist or your GI nurse practitioner. So please do your due diligence in educating yourself, talking to your doctors about your options or symptoms, and going from there. I just wanted to get the word out. So I appreciate you guys watching this video. If you guys are loving this type of content, please let me know in the comments. I will be doing some more longer form videos about some GI health topics and things that I see on a day-to-day basis while I'm doing clinic. Thank you so much. Thank you for liking, subscribing, and sharing. And stay tuned for more. Bye.